Ceramir Crown and Bridge Cement's a versatile bioactive luting cement that can be used with all your favorite restorations. Whether it's full metal or PFM crowns and bridges, lithium disilicate crowns, solid zirconia crowns such as Bruxer crowns. In fact, due to the hydrophilic nature of Ceramir Crown and Bridge, many of the additional steps that you need to go through with a resin-based cement on a zirconia restoration, you don't need to go through with Ceramir luting cement. Aluminous oxide-based crowns, pitot stainless steel, layered and pitot-wall zirconia crowns. You can use Ceramir with cast and prefabricated metal posts, and it works very well on gold inlays and onlays as well. So let's look at two of the biggest classes of materials that Ceramir is currently being used for, the lithium disilicate crowns and the solid zirconia crowns. And let's go step by step for both of these classes. To use Ceramir Crown and Bridge luting cement with a lithium disilicate crown, try the crown into the patient's mouth and adjust the contacts and the occlusion as needed. When you take the crown out after trying, simply rinse the inside of it with an air water spray. Afterwards, do one quick air blast to dry the inside of the crown. Again, because of the hydrophilic nature of Ceramir luting cement, there's no need or even a desire to dry the internal aspects of the crown completely. Be sure at this point not to use any kind of silane treatments on the inside of the crown. Unlike resin-based cements, there's no need to have any kind of a bonding agent between the Ceramir cement and the lithium disilicate crown. You're going to want to leave the prep slightly moist. Again, this is because of the fact that as a hydrophilic cement, the Ceramir actually likes having that moist dentin surface, and it's good for the tooth not to bone dry it as well. If you want to, you can use a HEMA glutaraldehyde solution, such as Gluma or G5 or another desensitizer if you desire, but it's not necessary or required. Mix the Ceramir cement, load it into the crown, and you've got 2 minutes of working time. The cleanup phase and the gel phase is at 3 minutes after mixing, and the cement will be fully set at 5 minutes. To use Ceramir Crown and Bridge luting cement on solid zirconia crowns, try the crown into the mouth and adjust the occlusion and the contacts as you normally would. When you remove the crown, simply clean the inside of it with an air water spray. Afterwards, use one quick air blast to dry. Again, because of the hydrophilic nature of Ceramir, there's no need to completely dry the inside of the crown. There's no need to use any special cleaning agents at this point, too, to get rid of any salivary contamination that you might find on the inside of the crown. And again, there's no need for any zirconia primers on the crown surface at this point as well. So no bonding agents required, and again, leave the tooth preparation slightly moist. The hydrophilic nature of the Ceramir Crown and Bridge cement likes to have a moist dentin surface. If you choose, you can use a HEMA glutaraldehyde solution, such as Gluma or G5, or another desensitizer if you prefer, but it's not necessary or required. Mix the Ceramir cement, load the solid zirconia crown, place it in the mouth with 2 minutes of working time, and the gel phase begins at 3 minutes, so you can easily clean it up by just peeling the cement off the side of the tooth. It'll be fully set at 5 minutes and able for you to go in and floss the contacts clean. Because of the hydrophilic nature of Ceramir Crown and Bridge luting cement and the fact that it forms nanocrystallines on both the crown surface and the tooth itself, many of the extra steps that need to be taken for lithium disilicate crowns or solid zirconia crowns do not need to be taken with Ceramir cement. And because of the fact that it works with nearly every class of restoration that a dental laboratory might make, Ceramir Crown and Bridge luting cement really becomes your everyday go-to cement.